So, can you share your experience in developing India's national plans on AMR?
Uh, India developed its national action plan. I mean, the work on this started in 2016 onwards when we helped the government, the Ministry of Health, put in place three governance mechanisms: an intersectoral coordination committee chaired by Secretary Health and with membership from all the other ministries and departments. Then a technical advisory group chaired by Director General of Health Services and DG with all the key stakeholders from various departments and ministries, and a core working group chaired by the Director of NCDC. NCDC is the National Coordinating Center for Antimicrobial Resistance and is the main designated institution for the national program for containment of antimicrobial resistance. So working with all these stakeholders, meetings were organized to identify the priorities and develop activities. And WHO helped organize a workshop for this and a national consultation in which the draft action plan was discussed by all the stakeholders. And then finally, this was endorsed at the Interministerial Consultation on Antimicrobial Resistance on 19th April 2017, at which also the Delhi Declaration on Antimicrobial Resistance was signed by 4 ministers, which is actually the political commitment, Indian government's political commitment for containment of AMR with a One Health approach.
Thank you, sir. Sir, do you think that each state needs to implement its own project to tackle the issue of AMR? Are we in need of a grassroots level approach?
India's National Action Plan has a 6th strategic priority, which is collaborations. The Global Action Plan has only 5 strategic priorities. First is awareness and understanding. Second is laboratories and surveillance to generate evidence on AMR. Third is infection prevention and control. Fourth is optimizing use of antimicrobials. Fifth is research and innovations. And India's National Action Plan, in addition to these 5 strategic priorities, also has a 6th strategic priority on collaborations at the international level, the national level amongst the disease control programs like the TB program, HIV, malaria, leprosy, influenza, etc. And then it also has a priority on subnational collaborations. And when we say subnational collaborations, the states are the most important entity in the health sector for India because health is a state subject. Therefore, state action plans for antimicrobial resistance were planned under the National Action Plan on AMR. And for this, WHO has already worked with the Ministry of Health and Family Welfare and the state governments to launch 3 state action plans, one in Kerala called CARSAP, another in Madhya Pradesh called MP SAPCAR, and then in Delhi called SAPCARD. And these have the ownership of the state governments as well as the oversight of the Ministry of Health and Family Welfare. However, in addition to the grassroots level approach, it's much more important to have the political commitment at the various levels. So if we are looking at state level action, the political commitment of the and the health minister are critical so that this can be prioritized within the health expenditure and the expenditure of the other ministries which are involved for AMR containment.
Thank you, sir. Sir, how important do you think is the alliance of multiple sectors in tackling AMR?
As all of you are aware, AMR is a complex, multi-sectoral problem, and it needs concerted action by all the stakeholders with a One Health approach for its containment. And in India, the key ministries include the Health and Family Welfare Ministry, but equally important are the Ministry of Fisheries, Animal Husbandry and Dairying, the Ministry of Agriculture and Farmers Welfare, and the Ministry of Environment, Forest and Climate Change, representing human health, animal health, food, agriculture, and the environment sectors. So all of them have to work together. But in addition to these, we also need other stakeholders to work together for a One Health AMR containment, both at the national level as well as at the state and the union territory level. This includes the Ministry of Ayush, the Pharmaceuticals Department, the Food Department, Drinking Water and Sanitation, also the food processing industries, the human resource development, information and broadcasting for spreading the messages, and science and technology, especially DBT, CSIR, and DST for the research aspects of AMR, as well as Niti Aayog at the national level. Also, hospitals and labs in the defense, railways, and the labor ministries are also important. In addition to these stakeholders, we also need stakeholders from professional councils, the Veterinary Council, Medical Council, Dental Council, Nursing Councils, the medical and the veterinary colleges, research institutions, the professional associations from human health, veterinary sector, food sector, and the dental sector, accreditation bodies, NGOs, civil society, private sector, the industry, donors and partners, and not to forget the FAO, WHO, and UNEP at the national level, and FAO, OIE, and WHO at the global level as the tripartite to push AMR containment with a One Health approach.
Thank you, sir.